Well, for a long time, I had a big fear of going to the dentist. I've gotten better over the years, but it still takes quite a bit for me to get in the chair. But oral health, of course, about so much more than just cleanings and cavities. So today we have got our new friend from Dental Professionals here to chat all the ways they are making smiles brighter. Dr. Sonia, thank you again so much for being here. I joke, my aunt was a dental hygienist growing up, and when I was growing up, and I was her worst patient. Not cleanliness wise. I mean, there I was fine, but like I was always seated in the chair, and she'd be like, "Peyton, calm down," and I just get so worked up. But it's a big deal for a lot of people. Kind of walk me through what you guys do there again at your clinic, and just kind of how you make that process a lot more comfortable.
Absolutely. Well, to start, your fear is normal. About 30% of Americans have a phobia of going to the dentist.
Yeah.
So our big thing is we want to make sure to create an atmosphere that's comfortable for the patients and let them know that what they're feeling is real, and to validate it. We're not a place of judgment. We want them to feel some empathy and some kindness, and really let them know that they can have their dental care in a way that's comfortable and pain-free.
Yeah, and I think even just you saying that assuages a lot of fears, right? Like knowing that the doctors and the hygienists as well understand your phobia, that this is common, and that you are, again, willing to meet them in the middle with that, and we're so grateful for it. So, of course, we want to stress, again, cleanings, you recommend kind of every 6 months or so? Is this
Most
kind of the
people
standard?
need it every 6 months.
Okay.
There are some that need it a little bit more often. Maybe their hygiene is not as great as it should be, or they have medical issues that require it. But most people at 6 months.
Okay.
Absolutely.
All right, so you heard that recommendation here first. And Dr. Sonia, we also want to stress not just cleanings. You guys also do a number of other services there. Let's talk first. I think even some kind of cosmetic procedures. What does that look like on your end?
Well, I love doing cosmetic procedures because, again, most people really dread going to the dentist, but that's one procedure they enjoy coming to. They want their smile enhanced. It gives them a lot of confidence, and so at the end of the day, they're just fun to do because you can see the tears of joy when we deliver beautiful dentistry to patients who have had a smile that they've been ashamed of for many years.
And we're so grateful again that you do that. I think veneers you work on as well.
Absolutely.
Let's talk whitening also, because I think there's sometimes some controversy there. Can we whiten too much, or kind of the safetiness of that? What does that look like?
You can whiten a little too much, and I will say a lot of people spend money on over-the-counter products that just do not add up over time. So definitely I would consider talking to your dentist about their whitening choices. In our office, we do something called Whitening for Life, and what that means is once you go through your whitening process, we give you a complimentary tube of solution every year at one of your cleanings, and that way you can keep up your beautiful smile without going through the whole process again. So it's
I love that. Whitening for Life.
Whitening
that
for
just
life.
Seems like a one and done, and so grateful again that you offer that. Something else we want to talk about, Dr. Sonia, I'm told that a lot of patients, especially women, deal with something called TMJ. Can you break down that for us?
Absolutely. So TMJ is not always just an issue with the joint itself. It could be the muscles. There may be a problem with the muscles of chewing. It could be the teeth positioning. So it's real important to find out the cause of the TMJ instead of just throwing Band-Aids on it to trying to fix the TMJ. You've got to figure out what's going on there. But we have to dive a little deeper also to see if there's sleep apnea. Make sure that we're having an open airway for sleep. Oxygen is so important when we're sleeping at night, and a lot of TMJ has an association with sleep apnea.
I'm also told a lot of people, and I'm in this category, Dr. Sonia, I grind so badly.
We're
and
all
I don't know why.
We're stressed all the time.
Yeah, truly. I wake up and I'm like, oh goodness, and I really have to relax it. So what are treatments looking like for that at your office?
You know, we do Botox a lot for that. The only thing about Botox, and I love doing Botox for patients, it gives them a lot of relief, but it does have to be repeated every 3 to 5 months. So there's a lot of upkeep with that. But really, a lot of times it's about habit control. We can make some devices that you wear during the daytime or at night that'll help with that habit and help control it. But it can be very detrimental to the teeth, so it is important to get it checked and fixed.
All right, so again, definitely see the professionals here on Whitesburg. Dr. Sonia, again, we're so grateful. As we wrap here, any kind of final tips, general things people need to put into practice, brush, shake? It's funny, I think we were told, brush regularly. I was told I brushed too much. So my gums started to kind of like...
You were probably brushing too hard. So do always use a soft toothbrush. That's very important. Flossing, the old saying, floss the teeth you want to keep. Unfortunately, that's true. You need to floss and see a dental professional at least once a year, at least, to just find out where you are and see what you need to do to take care of those teeth. It's important.
Yeah, and we're so grateful again that you help us do just that. Dr. Sonia, thank you for coming on. Before I let you go, tell us one more time again who you guys are, where you are, where we can book that appointment, and just find you guys here in Whitesburg.
Absolutely. Dr. Sonia Witzel, we're dental professionals on Whitesburg. We love our patients. We would love to see you. Give us a call.
Wonderful. We will do just that. Dr. Sonia, thank you again so much.
Thank
You're
you
so
so
talented and
much.
helping a lot of people, so we appreciate it.
Well,
Thank you.
I appreciate this time. Thank you so much.
Thanks.